Okay,
Yeah.
fab. Okay, so thanks, Steve, and thanks for having me back. I think I know everybody, but I'm Helen, one of the psychologists working on the Medical Needs in Schools project. And this morning's session, we're going to talk a little bit about looking after yourself. So I'm probably going to talk for about 20 minutes and then take some questions at the end. So what we're going to talk about today is to think about how we feel during the COVID pandemic and how that impacts on our general stress levels. And to think about why it's important to look after ourselves now and when things start to get back to normality in whatever form that might be. And we're going to think about some general principles and suggestions. And I guess my presentation today has been informed by discussions that I've had with my own team and your team, but also by the literature coming out on the impact of COVID on staff groups, and also the general literature on looking after ourselves. So I'm not going to ask you to share this with the group because of the webinar format, but I just wanted to just spend a minute thinking about how COVID and the pandemic has affected you and the way that you work, and how you're managing any thoughts and feelings related to this. I think my sense is that there's a real wide range of how COVID is impacting and how people are managing emotionally. So, of course, there will be some challenges and some stresses, but also a lot of people are finding positives and different ways of working and managing their home life, which are really helpful in some ways. I wanted, while you're thinking about that, to give you a bit more time, I wanted to share some of my own personal reflections, which I find also to stay on the recording, which is, I suppose, that it has been really noticeable to me how my baseline stress level is heightened. So when I go to Tesco's now, I notice I can be a little bit jittery sometimes. My startle response has got much more honed. So if anybody comes too close to me, I kind of take a little jump back, for example. So those really subtle ways of my body expressing stress, I'm noticing when I'm out and about. Although on the whole, I think I'm doing pretty well, and you probably wouldn't notice that too much if you saw me in the hospital. So something's going on inside my body there. And in terms of how I'm working, I think sometimes I can tend to feel a little bit guilty. So I've come across this concept of Zoom fatigue, so the impact of back-to-back remote meetings where you might not have that couple of minutes in between to walk from one place to another. But yet we still feel the pressure to book in meetings back to back because we're simply sat at our kitchen table and we don't need to move around. So that sense of guilt when then, I might be making a cuppa, or I might get distracted by something in my house, and how that impacts. So lots of really subtle changes for me, which all impact on my baseline stress levels. And hopefully you've had a bit of time to think about the impact on you whilst I've been talking. So let's spend a couple of minutes thinking about stress in general. So what are the benefits of stress? How do we recognise it? How often do we feel relaxed in our working day? And then what are the downsides to stress? So we need to think about what are the benefits of stress. If we didn't feel stressed, then life would be very different. So if I didn't feel a level of stress about the guilt of the times when I'm not working, that might motivate me to work less. It's the same for your students. If they didn't feel stressed about exams, they probably wouldn't revise as much, and so on. So stress can be positive, but it can have downsides when it starts to impact on us. So, for example, our sleep, our eating habits, our behavioural habits, and getting in the way of doing the things that we want to do, whether that's in our personal life or in our job performance. And often, I think we don't always recognise those subtle signs of stress. So a worrying mind, jumping from one thing to the next, starting one task and not finishing it before moving on to another, feeling that our shoulders are sort of pulled up towards our ears and not realising. So those very subtle signs can often go unnoticed because we don't feel overtly stressed. And if we don't really recognise the sign of stress, how can we do something about it? So how proactive are we and how productive are we in managing stress before we start to notice the more overt signs? So some of the things we might notice in our body is whether we feel hot and sweaty, maybe our face goes red, headaches, tension, and some of the more perhaps the more noticeable signs of stress like shakiness, numbness and trembling, the things that might worry us a little bit more perhaps if we notice them. And sometimes feeling a bit sick in our stomach or feeling like we need to go to the toilet. All of these are signs that our body is reacting to something. So why do we have these sensations and why does our body react like this? Well, we have a well-developed threat perception system. So our amygdala will react to any psychological or physical stressor. We know this because we've done scientific experiments of putting people in MRI scanners and asking them to think about something stressful. And we know that that amygdala lights up whether or not something's actually happening. So every time a thought goes through our head, that's remotely stressful, the amygdala will light up and will tell our body to react. During this time, the cortex, so that's the thinking, rational bit of the brain, will shut down and the body will get flooded with all of the chemicals such as adrenaline, which form part of the stress response. So our heart will beat faster, our breathing quickens, and the blood and oxygen goes to our main muscle groups, and that will cause all of the effects that I mentioned on the previous slide. So the important thing about this is to think about how does this impact on our daily life? Now, I'm not very good at PowerPoint, so sorry about the very basic graph. But the blue line you see is how I might respond to a spider. So there's a very clear acute stress response. I'm plodding about my normal day, and then I see a spider, my anxiety and stress levels shoot right up. There's that period in the middle where I do something, take some form of action to get rid of the spider, and then my anxiety comes straight back down again. But in the working day, we're much more likely to have a graph that looks like the orange line. So a slightly heightened baseline. So we probably don't wholly feel relaxed usually when we're in work. We're probably worried about the next meeting or our to-do list. And the spikes that we experience are generally less likely to be to the same degree as an acute stressor. Now, what would our COVID line look like? If we think about what are the thoughts that go through our head at the moment, it might be things like, you know, how am I going to manage homeschooling my child? If I get distracted in a meeting, am I going to end up like that BBC man that everybody always remembers? Am I going to be that one? Am I doing a good job for my students, or in my case, my patients? So that line might look very different to what we typically see in our normal working day, with a lot more ups and downs, maybe not quite to the degree of the acute stressor, but certainly over and above what we normally see. And the impact on that is that our bodies are going to be in much more of a heightened state of alert. We'll see that startle response like me when I'm walking around Tesco's, much more acutely. And we'll generally feel a lot more tired, and perhaps then an additional cognitive burden, because we're asking ourselves, well, why am I so tired when I haven't got my commute? I'm sitting at my kitchen table. I shouldn't feel so tired. But we simply can't underestimate the physiological effect of those increased threat perceptions. So what do we know about teachers and working in the education sector? Now, this research is quite old, but I think you'll probably agree that probably some of the stats will be still around today. So around 1/3 of teachers rated their job as extremely stressful. Teacher burnout is well documented. And we also know that stress is often associated with a desire to achieve. So thinking back to that concept of stress being a positive thing, most people go into these kinds of professions because they want to help and they want to make a difference, they want to achieve. And actually, when things get in our way of doing that, whether that's the regular burdens that come along with paperwork and the other things that you have to do in your day, or whether that's because of COVID impacting on your usual way of working, there's going to be an increase in stress compared with somebody that maybe is not that bothered about achieving huge things, and maybe has a bit more of a sort of a relaxed approach to life stresses. But we also know that if we are stressed, that it does impact on job performance across a whole range of factors, so spotting signals, verbal reasoning, forming sentences. And often you can hear that when people are doing presentations, can't you? You know, I stutter over my words sometimes when I'm giving presentations. That's my stress response getting in the way a little bit. In the caring professions, I think we can often struggle to recognise and to acknowledge when we're feeling stressed, and it can have a bit of a bad rep. But I think the main thing to remember is that if we're better able to manage our own stress, it's going to help us achieve better things for our pupils, and actually in our home life for our families too, because the more relaxed and happy we are, the better able we are to be able to support others. So what can we do? There's a few categories of strategies that we can use to help manage our own stress levels and to look after ourselves. So changing the triggers that we can influence. Often in systems and organisations, this might be limited. So you can't necessarily change the amount of resource your school has, for example, or your class size and so on. Certainly there's a lot of things about the COVID pandemic we can't change, but to think about what we can influence. Secondly, to think about the perception that we have of the triggers, which is not always easy to do, but is doable. To create helpful routines, and then to manage the effects of stress when we notice them. So I'm just going to say a few more words about each of these things. So thinking about the triggers that you can control, it's really important to focus on what it is that you can change, and prioritizing tasks is a simple way of doing this. So it might feel at times that everything is important, and how do you differentiate? Thinking about how you can break down that important category into urgent and important, so that it enables you to get things done that needs to be done quickest or have the most weight. What are the practical things you can change? So what aspects of your working day could you adapt in terms of perhaps the times that you work, the environment that you work in, and so on? And where you feel like actually, you know, there is not that much that you can change, and that there are these competing demands and things are not perfect, being compassionate towards yourself. And I want to direct you to a document that the British Psychological Society released yesterday for key workers, which obviously you all are, to think about how you can be more compassionate towards yourself at a time when there are competing demands. So really key to managing our stress levels and looking after ourselves is looking at perception. So we know that perception or appraisals of a stressor will impact on how we cope with it. And there's a huge amount of data now that links our cognitive style with stress and physical health outcomes, actually. So if we can manage to change our perceptions, it will have a positive impact on our quality of life. So thinking about when we feel that maybe we're not meeting our own standards, we're not doing a good enough job, those competing demands feel overwhelming, how can we bring that back to our values? So the way in which our workers had to adapt for COVID might seem to be in contrast to our values. So where we might value that connection with a young person, for example, and that feels interrupted right now, how do we bring that back to our core value? How do we connect with that idea that even though our way of interacting has changed, actually this is the best that we can do for that young person right now, and that contact that we have with them remotely or via the phone will still bring about that sense of them being held in mind and being thought of. So spending a bit of time linking back to our values even when it feels like the way we achieve them has been interrupted. Thinking about what you can't change and accepting that. So that doesn't have to be fatalistic, it doesn't have to be a negative, but it can be very much about accepting, and yes, feeling maybe frustrated or angry about that, but not trying to overly focus on the things that we can't change. And alongside that, also building in times to congratulate yourselves on the difference that you've made, even in the context of these challenges. And you can do that by spending time reflecting on what you did well, what you influenced and what you achieved, building that time into your team meetings so that you always have some space to focus on successes, and if possible writing it down maybe in a notebook where you can reflect on that when maybe you're having a bad day. Thinking about helpful routines. So there is always the temptation when your commute is downstairs to your kitchen, like for me, to get out of a helpful routine, but making sure that you're still getting enough sleep, that your diet, your alcohol intake, and your exercise routines are as healthy as they possibly can be. And thinking about how do you balance those home commitments that you might have? How can you discuss with your management structure what will work for you, enabling you to meet the needs of the job whilst also managing those competing demands, and not feeling worried about taking regular breaks, getting up and walking around. Just because you are sitting down in your house, that doesn't mean that those are not important. And in fact, they're even more important because we know that the cognitive effort of doing online meetings often exceeds face-to-face meetings, and especially face-to-face meetings that are in a group where you're not so conscious of having to look interested and alert constantly. I linked to that, giving some thought to having back-to-back meetings, and it's probably unrealistic to say don't have back-to-back meetings, but to space out where you can, even a 10-minute gap every couple of meetings will be really helpful. And consider turning your camera off. So where you don't need to have your camera on, turning your camera off will reduce sort of your amygdala getting triggered when you think, oh gosh, I looked disinterested, or that's not a flattering shot. All of those tiny little micro aspects to social interaction that are now part of life with routine working can add to our cognitive load. So, you know, it might well be that you're making a cup of tea while you're listening to me talking, and that's absolutely fine, because that will help your cognitive burden. So have a think about when that's appropriate in your meetings. And finally, thinking about managing the effects. So the first step is to actually notice what is going on in your body. So to spend a little bit of time getting to know your body and the effects of stress, noticing when your shoulders might be tight, noticing when you might feel tightness in your chest, or butterflies in your stomach, when you might be a bit more hyper aroused physiologically, to signs of stress, and finding times in the day to manage those effects. So in a 30-second burst, you can actually make a big difference to the way your body feels and to managing your overall well-being. So a really good technique is to breathe in for the count of 2 and then breathe out for the count of 4. So it's slightly counterintuitive in that you're breathing out for a little bit longer, but that actually helps to get the oxygen balance right in our body. So taking some deep breaths, maybe in between those meetings that you're doing via Google Hangouts, can make a big difference. Similarly, and this is something you can do during the meeting, so clenching your fists whilst counting to 5 and then releasing them. Again, that all helps you use up the excess adrenaline that will be going around our body in line with that curve that I showed you earlier. So that is a very quick run through of looking after yourself, and I'm going to stop sharing my screen and come back to you all for any questions that you might have.